We are here today to announce and celebrate a significant investment and milestone at Memorial University.
This initiative represents a partnership between the province, the university, its medical school, the federal government, the Canadian Institutes of Health Research, and one of the world's leading private sector innovators, IBM.
Taken together, the investments from the federal and provincial governments and industry partner IBM Canada total $50 million over the next 5 years.
The Translational and Personalized Medicine Initiative, TPMI, represents an innovative approach to delivering healthcare services that has the potential to improve care, to reduce healthcare costs, and to improve efficiencies.
Support units are provincial or regional centres designed to support those involved in patient-oriented research. They provide the necessary expertise to pursue patient-oriented research and help lead reforms in response to locally driven healthcare needs.
This initiative will bring bench research right to a patient's bedside and is focused on getting the right treatment to the right patient at the right time.
We see the improvement of health outcomes through the translation of research evidence into healthcare system and clinical practice right down to the individual patient. And the goal here is to produce a high quality and cost-effective healthcare system for tomorrow.
IBM is extremely excited about the potential of this initiative. It is an example of every sector stepping up to do its part at a time when public-private sector collaboration is so essential to drive continuous progress to address some of Canada's most challenging societal needs.
As a future clinician and someone who's going to practice in clinical practice, we sometimes see a disconnect between what's going on in basic science bench research and how that gets translated into the clinic. So to see an announcement today that's going to put an initiative in place that'll take that bench-side medicine into clinical practice is really great to see how they're going to draw the correlates so that we know that the basic science research is actually going towards something useful that's going to help patients.
Well, as a long-time researcher and now within the Canadian Institutes of Health Research, where I help design the programs and the programs that will allow funding of the research and knowledge translation, it makes me extremely excited and proud to see people come together in ways, in collaborative ways that we didn't many years ago, so that we can combine our skills and expertise to really make the impacts that we're looking for.
We have lots of analytics that are designed to do predictive maintenance and quality. So to deal with problems before they happen, right? To look at the ongoing data and recognize patterns from historical data and make interventions before problems occur. And it's the same idea here, where we can recognize based on historical patterns of health, based on the individual knowledge of patients' data, their laboratory data, their genetic data, and make recommendations that can keep them healthy rather than waiting until they become ill.